Governor Newsom is now taking action as coronavirus cases start to spike again across the state. That comes as many businesses and counties have started to reopen. Joining me now by Zoom is Dr. Maja Artandi of Stanford Healthcare to talk about the call to reverse reopening. Now, there has been a noticeable surge of COVID-19 cases lately in many states, including here in California. Some single-day records have been broken. How concerning is that, and what needs to be done?
The numbers look bad. Every day, as you said, now we have record-breaking highs. And that means that the pandemic is far from over. We are still in the middle of it, and I expect it to get worse in the fall. And not just me, but we all expect it to get worse in the fall. Over the last few months, though, we kind of have learned what to do, how to suppress further infection rates. So what everybody should do is wear a mask when you're not out with family, friends, or with people you live with. So if you are with someone or around somebody you don't live with, always wear a mask. Wash your hands frequently or use hand sanitizers. Try to do activities outdoors because it has been shown that the virus spreads less frequently outdoors. And then what I would really love to see is that our politicians lead by example. If our politicians would wear masks and consistently say how important mask wearing is, I think the population would be much more eager to follow.
You are the medical director of the new clinic at Stanford Healthcare that treats milder cases of the coronavirus. So what are you seeing, and has there been a real increase in the number of patients?
We do follow patients who have been diagnosed at the Stanford Testing Center or the emergency room, and we also follow patients who have been discharged from the hospital and they were admitted because of COVID. And we definitely have seen a significant increase just over the last couple of weeks. It's quite striking.
So health officials are saying these next 2 weeks are going to be very critical in how we respond to these surges. So what's your assessment on what needs to be done during that time? Are people just not being vigilant and wearing masks and practicing physical distancing?
Yeah, I absolutely agree with Dr. Fauci that these next 2 weeks are super critical because if we don't get a handle on the virus, it will spread much more rapidly and then we'll have a major outbreak everywhere again. The questions about what people can do or have they not been vigilant, unfortunately, I don't think they have been. I mean, we have been under lockdown for several weeks or months. And then the problem is that now that the lockdowns have been eased, people want to go back to their normal lives. They want to hang out with their friends. They want to go to bars and gyms and churches. And they don't want to wear masks because wearing a mask, and I have to wear a mask a lot, is not comfortable. So then they wear the mask like half face, the nose is hanging out, which doesn't do anything, or they don't wear the mask at all. And so the virus spreads, and that's why we see the surges.
And what about contact tracing? Do we have enough tracers to track people who have the virus to try to cut down on the spread?
The clear answer is not yet. So California is planning to have about 15 contact tracer per 100,000 people. For example, in San Mateo, that would mean that we need 115 contact tracers, and the county is looking to hire 150 contact tracers. And there's a lot of interest in the population to be a contact tracer, but it's not that easy. So it's actually a hard job. People need to commit to at least working 20 hours a week for at least 3 months. And then people also need to have special skills. So when you're a contact tracer, you need to talk about very personal medical information with patients. And some people just don't feel comfortable with doing that. So right now, we do not have enough contact tracers. Hopefully in a few months, we will.
So you probably heard there's a lot of talk that California might have reopened too quickly. Is it advisable or really even possible at this point to scale back this time?
Oh, that's such a hard question. So when we reopen, and we are not completely open, so we are in phase 2 or phase 3, all the numbers were quite stable. So we didn't have any increase in infections for weeks. We were never as good or as low as other countries, for example, in the EU when we opened. So we had a stable infection rate. And then, as you know, shutting down or closing the country for so long had really significant economical and social consequences. So we had to reopen at some point. Now, the problem is that since we have reopened and people are not as good in following all the guidelines, the virus has spiked. And there are really no national or even on state level guidelines on what numbers do we see and then what are the consequences. And so the counties are left to make the decision, and every county has its own decision-making process. And so one county then says, okay, we are a little bit stricter, and the neighboring county says, we are not as strict. And then that, of course, leads to animosities. And the social goodwill of the population is much less strong now than it was in March. People are just tired of this. The good news is the death rates have not increased yet, but we have to watch the hospitalization rates because, as you probably know, the hospitalization rates have increased significantly and death rates are always lagging behind a bit. So maybe once the death rates increase, we all as a nation have a point to make the restrictions a little bit severe again.
What can you tell me about pool testing?
Pool testing is actually a really cool method. So the theory is that, of course, we do not have enough tests available. We need to test many, many more people. And we also need to test a lot of asymptomatic people because COVID can be asymptomatic, and the asymptomatic COVID carriers or infected COVID people spread COVID as easily as people have symptoms. So how do we do that? And that's where pool testing comes in. And in pool testing, as the name says, you take a group or a pool of people, say 20 people, and you do one test. So you put all their samples together and then you do one COVID test. If that COVID test comes out negative, you know that none of these 20 people has COVID-19. But if the test then comes back positive, then you need to test all these 20 people individually. So with this pool testing, you can dramatically ramp up testing and not overwhelm the testing capacities.
All right, Dr. Maja Artandi of Stanford Healthcare, thanks so much.